morning. Thank you for being here bright and early. We actually have a full room, so that's great. Several of you may have been here yesterday to hear me speak. I did reconstructive techniques yesterday, and today we're doing jaundice and edema. For those of you who maybe weren't here yesterday, my name is Michelle. I have several different companies, but our major companies are mortuary services, so we work for funeral homes. We're commercial embalming establishments, so we don't wait on families and work for the public. We work for people like you guys, okay? So that's our main gig. Like he said, in 2023, I got approved by the State Anatomical Board in Texas, and I was able to get cadavers for our classroom to actually do training with actual cadavers for professionals like you guys. So that's a big thing that we do pretty often. I do classes usually 2 or 3 times a year where people fly in from all over and we do reconstruction, or I've even done some donor classes and some just basic autopsy classes off of those cadavers. So, all right, so when we get started here today, let's see, turn us on. All right, overcoming jaundice and edema. Obviously today we're going to talk about some different techniques for management, ethical and professional types of considerations where it's case by case, and then color correction if needed. As always, there's no photos or video of the screen. We do have deceased on here, some of which families have allowed us to take photos, some of which are cadaver cases that the State Anatomical Board allows us to take photos, but they can only be shared with professionals like you guys, not online. So he's going to be live streaming, but he won't be showing the screen today. All right, what's the focus point? Hand, space, and color. Several of you were in my class yesterday. I teach about this in all of my seminars, that hand, space, and color are your main focus points. You can have a fantastic case with great features on the face. Your hands look fantastic, but if grandma looks like she's been on a beach for 2 weeks, then you've lost that full picture for your families, okay? Just the same as color can be great, face can be great, but if the hands are horrendous, then you've lost that full picture for your families, okay? That goes the same for any cases that we do, not just trauma cases. Is it acceptable for viewing? This is the 5 things that I always have all of my embalmers ask themselves before we send a case out of our building. Number 1 is, does it make you proud? If it doesn't make you proud, it's not ready to go out to a family, right? Do you believe it's acceptable to show a family? Acceptable to show a family can come from so many different scenarios, but do you believe that this is something the family should see? Could something else be done for a better presentation? So many times the answer to that question is yes, but nobody wants to take the time to do it, right? Sometimes that's a little bit of tissue builder or a little bit more cosmetics. Something small could be done for a better presentation. Specifically on trauma cases, but any type of case, perfection, no, we're not looking for perfection. You will drive yourself crazy trying to reach perfection, but we are striving for excellence. We are striving for the best possible scenario that you could have given that family today, okay? So driving yourself nuts over every little thing for perfection, it's just not realistic. But what is realistic is striving for excellence on every single case. And then acceptable and identifiable is the goal. That's the terminology that I like to use, is acceptable and identifiable. Identifiable strictly, typically works for, trauma cases that you've done some reconstruction or some wax work to. But that should be the goal. The family should always be able to identify that that is their loved one and they were shown to them in an acceptable manner. Okay? So every case you take on, we're going to have a case analysis. Back to one-on-one, mortuary school. Wash completely before your case analysis. Figure out the condition of the body. Does it have edema? Does it have jaundice? Is there trauma? Is there black eyes? Anything like that. What's the time lapse that has happened? The time lapse that has happened from the time they passed away to the time that they're on your table. Any trauma or blood discolorations or any uncommon things that were performed during an autopsy or a hospital stay, any type of deformities. All of those things make up for your case, right, in your case analysis. So, of course, jaundice is characterized by the yellow-green discoloration of the skin and the tissues due to the presence of bilirubin and its breakdown product, which is biliverdin. Okay, that's the technical term for what jaundice is. Okay, Anybody know Jack Adams? All right, good. So Jack Adams put this out in a magazine a few years ago, and I use a few of his quotes for this because I love it. One chemical that was often used for treating jaundice was glutaraldehyde. However, used alone, it didn't preserve, just by itself. The difficult cases first needed to be embalmed well, or there won't be a chance for viewing. At this time in our profession, using chemicals that treat color but don't preserve tissue can be very costly. A certain amount of preservation is a must. We must first treat the tissue condition and then improve the color. Okay, he put that out in a magazine, I think it was a Dodge magazine, in 2012. And it's absolutely true. More and more cases that you're seeing come through your prep room now, if they have jaundice, they also have edema, right? Or they've got some presence of edema, or maybe it's full edema and just a little bit of presence of jaundice. Just more and more cases are coming through that it's both. It's a 50-50 now. Where back used to, that wasn't necessarily the case. But now we've got everybody in the hospitals, we're pumping them full of medication. They're on all kinds of medications while they're at home, right? And so every time you turn around when we're getting one from the hospital, it is, we've got jaundice, we're coupled with edema in some form or state, whether it's just in their legs or just in their legs and arms or full body, okay? All right, so here's the glutaraldehyde idea. Anybody ever use the Champion glutaraldehyde? Okay, a few of you. All right, so this is their kit, and I've used it before. My personal opinion is that Champion has really good fluid. However, this kit for the jaundice kit here is pretty costly, right? And the idea is that you put this entire kit into your case to make it not turn green. And that's great and all, and like I said, be more than happy for you to try it sometime, but it doesn't affect with your edema if you've got any kind of coupling with edema. And it doesn't preserve as deeply as typical formaldehyde does. That's just the reality of glutaraldehyde, okay? So, once activated, 2.4% of glutaraldehyde solution retains activity for 14 days, provided inadvertent dilution does not occur. Okay, that's directly off the website. So, what you've got is a 2.4% solution is going to retain that activity for 14 days. So that may be great for you that it's retaining some of that firmness that you're feeling if you're going to be varying within 14 days. And many of you might, but that's not always the case, right? Several times, at least where I live, that's not the case in a whole lot of situations within that time frame. Glutaraldehyde is more expensive than formaldehyde, so that's your negative. Formaldehyde excels in certain embalming scenarios, such as edema, and presents rapid and classical results that's familiar to you guys. Glutaraldehyde excels in the sanitizing ability, mildness of reaction tissue, clearing cosmetic effect, and prolonged but delayed action. Okay, so what that means is that it does fantastic on your cosmetics side for not turning your case green. The whole reason that a jaundice case turns green is that you haven't flushed all of the bilirubin out of the case, and it reacts with your formaldehyde that turns into bilirubin, right? That's the whole reason your case turns green. And formaldehyde specifically does that when reacting with the bilirubin, okay? Glutaraldehyde, it will not react with the bilirubin, therefore your case will never turn green, okay? However, it will never get the firmness that it needs to get, and it's only going to be active for about 14 days, okay? And it does not couple or treat any type of edema that you may have in your case, okay? So, fluid strength analysis, if you're not going the glutaraldehyde route, which many people do not go that route, okay? When you're looking at the time delay on top of whether you have edema or jaundice or both, is the autopsy or donor body, is its preparation time is always delayed. So maybe it's a jaundice case that has been autopsied, okay? So now we know we've got some delayed time in there. The delay is between death and time of the autopsy or the donor or the release from the hospital, okay? That's one delay that you're looking at. And then release of time till you get it back to your table is embalming. That matters. That matters is how much of a delay has happened. Did you get this case within the last hour and a half, or have they been sitting in the morgue for the last 3 days, right? And that bilirubin is penetrating through those capillaries, and it's just yellow as all get out. And or your edema is now very, very cold, and we've got pitted edema, okay? So, refrigeration is expected before and after an autopsy donor or morgue release. Delays increase the probability of dehydration, distension during arterial injection, evidence of some decomposition. All of these things, any delay means you have an increase in your preservation need, okay? An increase in your percent solution. Me and some of the guys last night in here were talking about percent solutions. And anytime you've got some kind of distant delay, you need an increase in that, okay? So time delays often require the use of stronger than average arterial solutions. All right, let's talk about milk. Anybody ever heard that or seen that done? Some of you are shaking your heads, yes. Goodness gracious. I had a guy not too long ago. I went into his funeral home. He's an older man. Love him to death, but I went into his funeral home and I'm opening some shelves and I said, "Hey, Randy, what is this?" And he was like, "Oh, that's cat's milk." And I'm like, "Yeah, why is it in the prep room?" He's like, "Well, I got told one time to use milk, so I bought cat's milk and thought I'd try it." And I'm like, "Randy, you don't throw this out of the prep room." He's probably a 70-year-old man. He tells me all the stories of them trying different stuff. They had the powdered like cat's milk that you mix up because he said milk was too expensive back then to just be experimenting, so they bought powdered cat's milk. Okay, so here's the reality about milk. Milk is used to help with jaundice in the living individuals by supporting liver function and flushing out bile. That's the reality. That's where that ever came from, is that in the medical world, milk can help with living individuals because it supports that liver function and it flushes the bile. That's where that ever came from in the death world, right? So the embalming process focuses on preservation and preventing decay. That's our whole purpose. So milk adds water and other substances that will interfere with the embalming process and potentially cause problems with tissue firmness, etc. Embalming fluids are specifically designed to preserve the body, while milk lacks that necessary chemicals, as you can imagine. Milk is a perishable product and can spoil quickly. It can lead to bacterial growth and decomposition. That's probably the biggest portion of all of it, is putting milk into an arterial system. It's a perishable product. It has sugar enzymes to it, and that makes bacteria growth and decay, okay? So milk introduces water, protein, sugar, and bacteria into the body, which can negatively impact preservation and create additional challenges. So we all disagree. Don't try the milk trend, okay, on a deceased. Traditional jaundice chemical may work for some jaundice discolorations, but not on remains that call for added preservative measures just to be possible to view. To be successful with today's jaundice case, we need to use solution that is strong enough to preserve the tissue. We can always cosmetize a green body, but we cannot cosmetize away decomposition. That was also in Jack Adams' statement in the magazine that he put out. And it absolutely rings true today way more than it did in 2012. So in a jaundice case, you've been told that you have to flush the bilirubin as much as you can, and then what? You can't go in with a high index formaldehyde, right? You got to go in with a low index formaldehyde afterwards. And here's the reality of that. In a lot of these cases now that are coupled with edema, you can't go into your case with a low index fluid. We're not going to be able to take over the edema that's there in that case. Okay? So what I tell my embalmers all the time is that I want you preserving that body. Sure, we're going to flush and we're going to try our best to get all of that bilirubin out. However, we are preserving the body. That's what your job is to do, is to preserve the body to the full effect. If we have something that turns into a green shade afterwards, we'll cosmetize that. We're going to try to counteract it in the process, but we've got to cosmetize the body, and we've got to preserve the body to its full extent of what's needed, okay? So if you get a case and it's coupled with jaundice and edema, okay, we're going to try to flush the jaundice, but now we've got to treat our edema. That way I've got a case that's fully embalmed and preserved well and can be viewed without skin slipping and blisters and all the yuck that comes with that, okay? So I'm going to walk you through a few different things today to try that after this slide. Flushing with pre-injection. Anybody ever tried this hexaethylphenol form? Hey, a few of you can raise your hand. So this is my go-to for flushing on a jaundice case or any severe discoloration, is this fluid right here. Now, Anything that you would like to flush with is absolutely fine. This one's got 8.2% index, so there is a little bit of low index that goes into it, but I have found that it's the best one so far for clearing some of my jaundice or major discolorations. Now, here's something that I have found with a lot of embalmers when doing a pre-inject. When doing a pre-inject to flush, they're opening up their vein and they're running their pre-inject all the way through with their vein open, okay? Here's the reality, especially with this fluid. You want to open your vein, or what I do is I open my vein for just 3 or 4 seconds. I get that big burst of the dark blood, right, that comes out first in that first 3 or 4 seconds, and then I clamp my vein back off. And I'm going to build the pressure, and I'm going to let your pre-inject of whatever you're using sit in my arterial system, maybe 5 to 10 minutes, okay? So after I get it injected into the arterial system, I'm over here, whatever else I'm doing. Sometimes I'll start putting that through the arterial system, and then I'll go in and start shaving and stuff while I'm letting it sit in your arterial system. It's got to sit in there and do its job versus just running straight through your capillaries, especially with a jaundice case. Because the whole idea of jaundice is that it has penetrated that yellow. You guys seen that in the arteries. It is through the tissues, through the capillaries. That yellow is deep sometimes and dark in all of those areas. So I want to let my fluid sit in the arterial system and do its job for 5 or 10 minutes. Then I come back in and I will open up my vein, press fluid through it, and let the rest of that come out, okay? That's typically how I want to do that, specifically with a jaundice case, is let it sit. For example, this is just with Hexi by itself. This was a pre-inject only, just on discoloration. No embalming fluid yet, just a pre-inject of how much it changed this discoloration here. Same thing here on this ear. Okay? So, as we've already talked about, jaundice is a buildup of bilirubin in the blood. Infants, normal and clears on its own, like a live infant that has jaundice, right? Maybe my baby had jaundice when I had him, and they said, take him out in the sun, put him in the window, right? Kind of clears on its own. It occurs if the liver can't efficiently process red blood cells as the breakdown. And then biliverdin is the green pigment that's found in the bile. One thing that's big is check the whites of the eyes for signs of jaundice. So there's also such thing called sallow, okay? Sallow is when the kidneys are not operating, they're not processing functionally well, and so you get what's a sallow color. Sallow is not the same as jaundice, okay? Sallow in the body, and I tried to get a picture of sallow for you guys, and I just couldn't get one, but because it's not as common. But sallow is a yellow tint, but there'll be no signs of yellow in the eyes whatsoever, because it's not a liver problem, right? So it's not all the way through the functionality of the body. So that's a big thing for always determining, is it sallow for the kidneys not functioning properly, or is it jaundice? And that's actually checking the eyes, okay? Any of you here work primarily with African American cases? No? Okay. So I work a lot with African American cases, and sometimes it's pretty difficult to tell with an African American case if it's fully jaundice or not, because we have what African Americans consider a really dark African American, or a high yellow is kind of the terminology that they'll use, which is a light-skinned black person. And so sometimes it's hard to tell. So just looking at his body, you're like, it's got a little bit of a tint to it, but is that just the pigment of his skin or not? Opening up those whites of the eyes will always tell you if this is jaundice or if this is just sallow from the deceased having a kidney problem. Okay? That's where you always want to tell from. All right? Pancreatic cancer causes can be severe. Severe jaundice will not be washed or flushed away. It must be dominated with a more powerful red tone. Sometimes a full bottle of dye may be needed to dominate the green, depending on what dye you're using and if it's concentrated. That's also from Jack Adams. But severe jaundice will never be flushed all the way around, just like we talked about a few minutes ago. If it is slight jaundice, great. That Hexi is going to flush it. You're not going to have any problems. Go in just as normal. If you have severe jaundice, it's not going to be flushed away just with any pre-inject by itself. Okay? severe jaundice is going to be able to flush 80% of it, but that 20% is still going to be there, and it's going to react to your formaldehyde when you inject with formaldehyde. So we've got to overcome it with a dye, okay? So in my color theory class, I teach a lot about what colors go hand in hand with each other, okay? Complementary colors are what also go against each other and cancel each other out, okay? So on the color wheel, you've got red and green. Red and green complement each other. They also cancel one another out, okay? So in your makeup kits, if you've got a deceased that's got a little bit of red, what do they want you to put on it? That seafoam green color to cancel some of that out, and vice versa. What cancels out here for green is red. So if you know you've got a severe jaundice case, we're going to put a lot of red dye in your tank. A lot of red dye in your tank, okay? Now I'll walk you through some of this. So this case is obviously severely jaundiced. The screen kind of makes it a little bit of a bluey color, but this is another way of determining severe jaundice or not, when everything inside has that yellow tint to it, right? Everything inside is just so yellow, okay? This is also a frigid kit. Frigid has the same thing as Champion, except theirs is not glutaraldehyde, but they have a kit. You're supposed to buy the kit and specifically use their kit to flush your jaundice case, all right? Take as you will. Sometimes I think it works well with decent, slightly jaundice cases, but not extreme. So here we go, get started on this case right here. And this has after we have started to flush, and so you see how much more that yellow has come down, but we're definitely not out of the woods. So again, these lights kind of make it funny to how you see this, but we've got a little bit of red dye in the tank to try to overcompensate some of this yellow that we're afraid is going to be turning green, okay? So this is a little bit more here of the color rubbing versus after we flushed. You can always tell after you flushed, it didn't flush all the way out if it didn't flush all the way out, right? Always, you can always tell. And in those instances, I know that I'm going to overcome what's going to be green with a red tint, okay? So this is even more dye here. So you can see that they've went in with even more dye so that they can overcome this severe yellow that was there. And at times, in the beginning, it can be a little scary because in the beginning, you're like, holy cow, like Jack Adams said, sometimes you might need a whole bottle of dye. And in the beginning, sometimes you're like, wow, this case is really turning red. But it's okay, because if we know we're going in with a high-index formaldehyde that's going to possibly turn things green for us, it's going to counteract the tube, okay? So we're going in very, very red here on top of this. You see how red we went at this point. And so, again, it's a little scary at the time, but we know that we flushed him as best as we could flush him. He's still got jaundice in him. I know I need to hit him hard. He's got some edema in his legs, and I know that I need to clear some of this out. We've got discoloration in our fingertips. He's got a lot of problems from the hospital. He's been in the hospital in the morgue for 3 days before we even get him, right? So I know I've got all of these problems. And so we're going to overcompensate with red dye to the best that we can, all right? You can kind of even see here in this hand how much we're overcompensating with red dye, okay? So this is kind of where we're at the end of the day, okay, give or take, obviously, of how red we are. 2 days later, this is where we are, okay? You still can see we've got a smidge of some green tint into this area right here, but all of this, that red has come down and it's overcompensating for the little bit of green that came through. Yes?
Maybe I missed this, but
sure.
When you're doing the dye, so you're doing a pre-injection first, but then are you doing Hexi with dye before you do a higher index fluid?
You absolutely can, yes. This case, we didn't. Our mind bombers, we didn't do that in there, but you absolutely can, 100%, yes. However, what on this case specifically, they just flushed 100%, and then they went in with their arterial fluid with almost a whole bottle of dye. Okay.
What's your mixture ratio on your pre-inject, and then how many gallons? Like, what do you use?
So on this guy specifically, we did 2 bottles of Hexi with a few drops of water. Okay, this much water. I mean, not much water at all. And like I said, I opened the vein, I let it flush for just a few seconds. I mean, 3 seconds. I just want that first bit of that dark blood to come out. And then I let it sit in there the rest of the time. And then when I open it back up, I flush it through with one more thing of a pre-inject of some sort. So like we use 1 point with Pierce. So I'll flush one more behind it to flush that hexy out. Then I go in with my arterial fluid. Okay? So what I'm trying to show you with these pictures specifically is that don't be scared in the prep room that you're like, oh my gosh, he's way too red. Okay? Because this is what you got 3 days later before service. The reason is because red counteracts green. So any of the green that's going to show up because we use high index embalming fluid and we're obviously not able to flush all of your jaundice is going to counteract with that. That red is going to overcome some of that green. Okay? So there he is, like I said, 3 days later. Still need a little bit of cosmetics? Sure, absolutely a little bit of cosmetics. But you don't need, I really hate that because this screen makes him not look near as good as my pretty screen here. Look at my pretty screen, he's all nice and pink. Up there he's like kind of gray. I'm like, he didn't look like that. You gotta have a little bit of cosmetics, sure, but not what we'd have to have had we not put any red in there, right? You'd have a whole body that we'd be looking at. And I got some of those to show you in a minute. Here's another example here. She doesn't appear that way right here. I don't have a picture of her eyes, but her eyes are just bright yellow, okay? And so, same thing. Went in, started injecting, and this side, look how red this side was in the process of the embalming side. Now, I think they put a little bit too much red dye in there. I told my apprentice, hey, that one might be a little much, right? Pull back a little bit on that. However, this is what you got 3 days later. Okay, it comes down. It's going to come down and over counteract that, and I don't have a green case. So here's this guy. We all agree, severe jaundice. You're never going to flush that 100% out. I don't care what you use. Okay, it's never going to flush 100%. Have the confidence of knowing, okay, we're going to try to flush everything we absolutely can, but we're going to overcompensate with red. This is him 3 days later. Okay, ton of red dye in the time frame. In your case, after flushing him, it overcompensates with that green as you come out. All right? So if you ever had a body clear and the next few days start to turn green, right? You ever had one that looks great right here for, 2 days, and then you come in and you're like, oh, they turn green. You know why that is? Not using dye. Because embalming fluid has dye, right? Most of your embalming chemicals have a smidge of dye. But it wasn't enough dye to overpower the green that's going to come through within 2 or 3 days. That's why Jack Adams said, hey, you have to overcome it with a high-powered amount of red dye. Because the amount of dye that's in your normal embalming tank, your normal embalming fluid, this body here was embalmed with Care 25 from Pierce. Very nice pink color, right? Plus some other stuff, who knows. But that was their color that came from that. And so, looked great. Hey, Michelle, this is one of my embalmers. Hey, Michelle, look, I flushed it all out. Looks great. Didn't have to use dye. I said, all right, let's wait. We'll see it. Let's see it in 3 days. This is what you got 3 days later. And I'm like, great. Now we have a full cosmetic case because you didn't use dye to overcome the green like I told you to do 100 times. Okay? So, just because it's cleared out in the beginning, the actual dye is what's long lasting. Okay? So this is what you were asking me a few minutes ago, like two hexies. This one's a gold from Eccles. It's a pre-inject, right? Typically, that's kind of what I do, right? So slight signs of jaundice coupled with other discolorations without the presence of edema, a thorough pre-inject flushing without the fear of waterlogging, okay? Now, Michelle, it's full jaundice and full edema, okay? All right, now you got a bigger problem that you have to solve. Because I can't waterlog my case and fill it with so much pre-inject when it's severely edematous, right? That's waterlogging your case even more. I got to treat the water that's inside my case more than I care about the color of my case. Okay, does that make sense? I know it's a hard concept sometimes for us to follow, but I got to treat the water and the edema. I've got to embalm as though this is an edematous case and not be so worried about the jaundice. Sure, I want to try to flush the jaundice the best I can, but I'm confident that I can cover up green or I can overcompensate for green in my embalming tank I gotta treat my edema first, okay? So this lady, oh, this is a sallow one. This is a sallow one. I did get one picture. This is sallow. No yellow in the eyes whatsoever. Looks like we got a yellow tinge to us. Again, this screen's putting a weird color on this for you, but looks like you got some yellow to it. This is a sallow case. This is not edematous, okay? This guy here, we've got some jaundice and we've got some severe discoloration. So I went in both on this one with Hexy. Not only did Hexy clear this full discoloration, but we're flushing some of that jaundice. Again, look here. This is not severe jaundice. Look at his arteries here. They're not yellow, right? So I don't have to worry about severe jaundice. So I'm not going to go in and overcome with a half a bottle of red dye. I don't need to. It's only for severe jaundice cases that we're discussing. If you can clear something like this 100% out, then go for it. You're going to be just fine on your normal embalming, okay, without severe cases of dye needing to be placed in. Okay, this man is a donor case, okay, so what's the problem with a donor case? I got to inject all these different arteries and hypo a whole bunch of spots. So just kind of shows you in the flush of that, this is how jaundice he is. He's been dead multiple days. He's went for donor. Now he's back to me. You can forget it. You're never going to flush that jaundice 100% out at that point, okay? And all of the hypoing that you got to do, that stuff is going to turn green. It's just the way that it is. But if you can embalm that face where you're able to overcome some of the green that's going to come through, that's what you want to do. You can kind of see here in our tank where we have hypoed, and in the tank we've got high levels of dye in the tank. And so there's certain spots that have come out high levels of red, but around those areas are still turning out green, okay? This is that poor baby situation as well. Very severe jaundice. You can even see as what's coming out here. Just trying to clear that as best you can. The problem with a baby who's got jaundice, if you're not able to arterially inject, and you're going to have to topical embalm and or you're going to be soaking your infant or hypoing, you can never flush any of that bilirubin out whatsoever, okay? So you got to know that it's okay to be able to cosmetize green. That's kind of how we're going to finish up with you, is the cosmetizing green. So poor flushing and preservation. Edema with jaundice is common and very dangerous. The fluid content and nitrogenous waste build up in the body neutralizes preservatives that's used for embalming. This lady is embalmed and is getting ready to go into her casket. And as you can tell, she has turned this god-awful dark green color. But the biggest problem is not the color. The biggest problem is we have color and we have edema problems, okay? So this was her to start off, all right? This was her, severe jaundice. So this is what happens when you go to just be trying to treat your jaundice and you're not trying to treat your edema, okay? So about 6 days later, I got a phone call from the funeral director, and he's like, hey, Michelle, one of these cases your guy sent me is bad shape. I need you to come check it out. I'm like, all right. So I say to my embalmer, I'm like, hey, what was up with that case? He goes, oh, it was full of edema. I mean, I treated it, but it just had so much edema in it, yada, yada. I'm like, okay, what'd you use? So he walks me through to use it. I was like, that was not enough fluid right off the jump. Let me go see what we're dealing with. So I get there, and this is your color. And I'm like, oh, why is this the color? Because you didn't flush all of the bilirubin out from the beginning, and you didn't overcome it with any red dye. That's the first reason. However, my second problems are these. You also didn't overcome any of the edema because you were trying to keep her from not turning green. So now she's going back, right? So now we've got big, huge blisters. These legs are just completely, at this point, like I said, pulling blisters. It's completely in bad shape. And the reason is edema is water within your body that you got to get rid of. It's just the reality of it. And so being nervous of making your body turn green so you don't treat it as high index as you need to treat it, doesn't treat your edema. Now guess what? You got a green body and a blistered body. So neither one of those ratios work for you. All right? So we go back in. I'm going to have to just go back in, re-inject everything. But at this point, I've got to really overcome that color and try to put some dye in there, and then I'll have to cosmetize on top. But biggest thing on this takeaway is what should have happened for this case. She was severely edematous, so you can't just flush and flush and flush and flush, and I understand that. That's what he was saying. She's full of edema, so I can't flush a whole bunch of fluid through her because I'm going to waterlog her even more. And I agree with that. Flush one time through her, and then go in with high index fluid. Take care of the edema 100%. Go in with high index fluid, wick the case, get all of the edema out of the case, and if she turns green afterwards because you hit the case hard, she's well preserved, and we'll cosmetize on top of that. Okay? That's my theory behind it, and that's kind of how I operate, is I want the case fully preserved first. This is just another black case to kind of show you. You can see as what's coming out on the sides here. She doesn't look very edematous. She just looks like a light-skinned black woman. But African-American cases will trick you. You have to check those eyes every single time. Okay? All right. So, treating excess edema. This is what I mean by wicking the case. He should have treated the edema. We should have done a high level of red dye to try to overcompensate some of the green that may have happened from that lady. And then he should have wicked this case. So wicking the case. Anybody wick their cases? Hey, okay, well, you don't count, Dana. So wicking your case is major. And I would tell you, you could walk into my building and at any point in time, there's probably 2 or 3 bodies that are setting up in a weird position being wicked, okay? What that is any edema fluid that has captured in your body. So you used high levels of index or edema fluid, and you got the edema to come down out of the hands, right? Well, what happened? Came down out of the hands, and your hands look great, but then there's this pouch right here, right? There's this weird pouch of fluid. You think of that fluid as displaced water. Think of that fluid as water that is inside of my case that I have to get rid of, okay? So this is what you got after embalming some severe edema, whether it's got jaundice or not. Severe edema, this is what you got. You're proud of this because of how much those hands have come down. But this is where it all collects, right? It collects right here in these arms. And this causes a problem for you sometimes, because sometimes it collects there, and that's real fragile skin, right? And so the minute you go dress it and you drag it funny, now you got a skin slip and you've got non-stop leakage in those areas. Not to mention, if they want grandma to wear a dress that's short sleeve, now you got these big bat wings on her arms that look funny, right? So, as soon as you get your case to here, this is great, but now we got to get rid of this extra water. So what you're going to do is you're going to take a scalpel and you're going to just poke one hole, okay? I just want one hole that you're going to poke. And then you're going to channel the area for fluid to flow from, okay? So fluid goes in the path of least resistance, right? So I'm going to take my forceps and I'm going to make several paths for that fluid to come out of inside that area, okay? One small hole. Do not take your scalpel and slice there. Okay, I had a student do that one time and I was like, you just ruined the whole case. Because now you have a problem that then that area, if the skin's too, the skin's too thin to suture, now I got a big leakage area. You don't want to do that. Just a small poke, one hole in that spot. And now I'm channeling all through there. You can kind of see we're already dripping some fluid just in that process. Then I'm going to stick just a smidge of Webroll in there with a long string, okay? You're not trying to close this hole with Webroll, so I'm just sticking it in there on a wick just about this far. That's all I'm sticking it in there, okay? And I'm going to do the same here. So you can see here, they have placed the feet, or I have placed the feet up here on this little contraption that we've got in the prep room. So the feet have been sitting for a few hours, and look how much of that has come down already. It doesn't matter. Sometimes people will say, well, Michelle, nobody's going to see the feet. I don't care. I want the water out of the body. Every extra bit of water that's in that body is a secondary dilution that every day is diluting your percent solution in your case, okay, every single day. In my particular case, when I send that body to you guys at the funeral home, I have no idea what the story is. I don't know if it's sitting at your funeral home for a week or 2 weeks. I don't know. So I want all of the problems to have ceased before I send the body out to you. And so I want all of the water out of the case. That way it's no more secondary dilution happening after the fact, okay? So I've placed the feet up here after embalming. You see how much of it has come down already, and now I'm gonna take a scalpel, I'm gonna poke a hole. See, this is my forceps here that we're channeling. Just keep your hand here, don't go poking it out, 900 more spots. But I'm gonna channel all directions in the same spot here. Just placing a little bit of rub roll there so that it can wick out. You can see here, this is within 2 seconds. Look how much of that water blister is already coming down. The water's got to find a place to go, guys. And so you're just letting it out. You're giving it a spot to wick out. This is the same thing here with this arm. So now I'm letting this wick out so that I'm not going to have any displaced water. How about also you keep your hands up and they look phenomenal, and then one of your dopey interns comes in and puts the arms down, and tomorrow morning you come in and your hands have edema back in them because they put the hands back down, right? It happens. That's because the water's got to find a place to go. So get it out of your case, okay? I like to wick mine overnight, but guess what? Sometimes I can only wick for a few hours. It's better than nothing. Sometimes my embalmers will say, hey, Michelle, it's noon. The funeral home said they're going to be here at 6 p.m. And I'm like, wick it till 5, and then close it up before they get here. Any amount of time that we can wick it to get whatever we can out, we're going to, okay? So then this is the leg, 20 minutes later. All of this is coming out to have less problems for me in the future. Now, this is her arm now. I no longer have this big pocket, right? Just from one hole. Yes?
You're going to discuss closing it up with bad skin?
Yes, well, yes, absolutely. So whenever it's real bad skin that you're talking about, I don't know what you're discussing. When it's real bad skin, I won't poke a hole directly in that bad skin. I'll poke a hole over into the side where it's not so bad, and then I'll channel into that area and place the arm up where it'll still flow out. So when it's real thin bad skin, I will not poke a hole directly in that bad skin. Because then we all know a trocar button won't hold in that, right? So if it's really bad skin, I'll pick over into the side somewhere, and then I'll channel that distance. And so then I'll put the arm up. Listen, I'll put the arms up in some weird positions, okay? I brought a ladder in the office the other day, and I had a ladder in beside the prep room, and the arm, I tied it with a sheet, and I tied it where it would be standing up because I needed this to wick. And I was like, I can't get it. Like, it wouldn't wick because of how I had it sitting up. So I was like, hey, Sean, bring that ladder in here. And so he brought it in. I set it right beside the table. I just held the arm up and just wrapped the arm with a sheet, nothing major, and just held it up for 2 hours, just so that spot right here on that person could wick out in that one spot. Okay, you got to get creative sometimes because I want the fluid gone. Okay, now this is your leg. An hour and a half later, I feel way more confident sending this out now than I did whenever it was still just all sitting in that leg. Sure, it was treated, but it's a constant secondary dilution that we're looking at. Okay, this is a different viewpoint for this lady. We don't have those bags in her arms anymore. You don't have to worry about any of that. Now, as we all know, sometimes with this, just like with her, your hands, then you did a fantastic job if you've got all these wrinkles because you got all the edema out, which is what you wanted to do. However, if the wrinkles are too much, grab you some stone oil or some massage cream and a hot tool to massage some of those wrinkles out to make it look normal, okay? Whatever you've got to do to make it look a little bit normal is absolutely okay. And then those 2 holes, or however many holes that you've made, go in with a trocar, do a trocar button, and then I go in with Flex Seal, the spray can of Flex Seal that you get from Dollar General or as seen on TV. That is my most favorite thing. You should try it. I told you I called Flex Seal. I'm like, you guys should really sponsor me for the funeral business because I don't know how many people use it now, but I use that Flex Seal for Y incisions. I use it for anything that you can imagine. And it's the spray can. I was actually watching the commercial several years ago, and the guy was talking about Flex Seal fixed his boat. You've seen that commercial? And I remember sitting there and I was like, if it can hold his boat, I bet it'll hold my autopsies. And so I went and bought it and tried it, loved it. That's our go-to spray, always. So then I just Flex Seal on top of it. I put the can up, I Flex Seal in that area, let it dry real quick, never have a problem. If I have a small problem because right here, pools just a little bit, I put a little bit of drying on it with some Rebel, and I wrap it with saran wrap real quick. Should not have any major problems. But like you were talking about, sir, this case not technically is that bad, but over here you can see that skin's way more fragile down here. I would never poke a hole in the skin where it's so fragile. Scoot over to the side. Okay? So that's what we started with, and after embalming, you did your thing, and now you've displaced all of that excess fluid coming out. So here's the same thing for in the face, okay? This is a case that in the face, I don't really know what happened in the face, but I know that it swelled, and it swelled fast, and it was a cold case, had been in the cooler for a long time, all the things. Next thing you know, the face really swole, the jowls were really big, and this guy, shouldn't happen to anybody, but this guy was a big bishop in the church, and so this was going to be like a huge service. And I'm like, yes, we have to get that down. Like, there's no way you can keep that. So we've done the exact same thing here. Go to the side of the face, back towards the ear, all right? And I made an incision there. I just made a small incision. Now you can see I'm in there with my scissors, and I'm cutting a few like channel areas, and then I'm going to go in with forceps as well, and I'm going to channel this area the best that I can. So I'm going in, I've got my forceps all up into this area, because I want to channel as much of that down as possible. Just different scenarios that could happen for you. And so now I'm wicking out that portion of the space, okay? So this is probably 2 days later, I guess, that we're actually trying to wick all of this out. Because you name it, I did everything else. I tried doing a heat spatula and stuff, and it just wouldn't come down in that jowls the way that I needed it to come down. So I said, well, let's get rid of the fluid in that area. And so now I've wicked out of his face, okay? So you can see right here how much of this is coming out in that face area, all right? So that's kind of in the background. How much on each side I've been able to pull out of those jowl areas. Okay, so this was his picture here. Man, these lights do not do this justice. But this was his picture here, very large jowls into this area, and I've just gotten all of that to come out by wicking the case. All right? Okay, so in and up on your complementary colors. So we've talked about jaundice as a whole, we've talked about edema as a whole, we've talked about the two of them coupling together. So now it's like, all right, Michelle, now you've told me, hey, don't worry about the green. Try to overcome it with your red dye. But if it turns green, it turns green. Now you got to fix it. So now I got to teach you how to fix it, right? So complementary colors are opposite sides of the color wheel. That's what I talked to you about a minute ago. But this way you can actually see it, all right? So you can actually see this one. You can turn for the screen if you want on this. Okay. So red to green, orange to blue, violet to yellow. I do a whole class on these colors, but I'm going to brief this real quickly for you. True complements are mixed together. They will neutralize and cancel each other out, all right? So any makeup artist, cosmetologist, anything of that nature, they want to know what's your skin type, what kind of hair color has been on your hair before, because they have to know if there's anything that they need to neutralize or cancel out, all right? So just like in your prep rooms, if you've got a bruise or something, right, depending on most cases in your prep room, you've got this violet and you've got like this yellow and the seafoam green color correctors in your prep rooms, right? Those are the main ones that people have in their prep rooms. And so if you've got a bruise, a purplish bruise of some sort, then you're typically using that yellow color corrector on top of that purplish bruise before you go in, kind of like a concealer. Okay, and that's the purpose of this. Red and green work the same way. Red and green are the exact same way. So if you have a case that's really red, for example, like carbon monoxide poisoning or something, okay, you've got a really red case. What you're going to do is a light shade of that green seafoam moss is what you're typically using in your prep rooms to overcompensate for that green or for that red that's there, right? So it's because these are canceling each other out. This is on the opposite side. You are color correcting for the green. So what do we want to color correct green with is red, okay? So this is kind of an example for you. At my place, we have this green head that we teach students with, but anytime you've got dark green, we're going to go over it with a red, okay? Now, the color of green depends on the shade of red that you do. If I've got a light green and I go over it with fire hydrant red, then that's not gonna work for me, right? Now the red's gonna come through on my makeup, okay? So if I've got a light green, I wanna go over it with a light red, maybe into a pinky tone, okay? But this is dark, dark green, so that's why we're covering it with dark, dark red, okay? So you cover with dark, dark red, then you go in with your foundation on top of it. You ever just had a case that maybe it was really bruised and a bluey type color, and you put foundation on it and it looks fantastic, and then you get into the church and you get under the lights and that blue starts kind of coming through underneath your case, and you're like, oh, you can see that color coming through. That's because you haven't color corrected the issue, okay? That's the purpose of that. So for this, you would color correct with red. So these is what I've always kind of used for color correctors. I just throw this in here. Frigid just came out with a full color corrected line. I think it's phenomenal because it has the colors that you need. It has orange and green and red and blue. And so just so you know, that's out there for you to try if you need it. But here is a severe green case. Okay, so I get a phone call. Hey, we've got a really bad green case. Do you think you can come cosmetize? My guys have tried cosmetizing it twice and it just doesn't look normal. We'll pay you if you'll drive down here and cosmetize. I'm like, yeah, no problem. Send me a photo so that I know what I'm working with and I'll pack my stuff up. I'll head that way. So they do, and this is what I get, right? So she is severely green. Would you all agree? Right? She is severely green. Now, I will tell you, when I get there, she is embalmed very, very well. She is embalmed very well. No preservation problems, I think, at all. I think she's in great shape. But she's green. And again, I am not a proponent for turning them green. They should have, in their tank, put a ton of red dye, and they would have been way less green than this. But we can cosmetize green and still have a well-embalmed body. So this is literally all I do. This is all you do if your case turns a little green. You're just going to color correct it with red, okay? I'm personally doing airbrush here, but you don't have to do airbrush. You can use traditional makeup, all right? So you see here, I've went over every area with red. And I've even come down into this area because I'm not sure what she's going to be wearing or anything of that nature, okay? So I've brought all of this down into the down area and into her shoulders just in case she's going to be wearing something low. Okay? Ooh. All right, so here's just a close-up picture. It is not painting deep dark red on top of it, because then you're going to have a different problem trying to overcompensate the red. Just light shade of red to go over the green. It cancels that green out. Okay? Then I start in with my normal cosmetics. Again, I'm using airbrush. You can use traditional makeup if you'd like. Here's your hands. They were green in this area, and now I've went in with a light shade of red, and then went on top of it with our cosmetic color. Now this is her after I've cosmetized her entire body, okay? So as you can see here on the sides of her arms where I didn't do it, we're still green in these areas, right? But this area here, her entire face, we're not whole green anymore. That green is not coming through anymore. Just color correct it with a little bit of red. And to be honest with you, had they had a bunch of red dye in their tank, they probably wouldn't have even needed this after the fact. Okay? Red is your color corrector to green every time. All right? Any questions on this? Any questions on anything so far at all? We're here in the last few minutes, so we've got a few questions I can answer. Yes?
Yeah, earlier you were talking about a little bit of dye versus a lot of dye.
Okay.
In terms of measurements, like ounces per gallon, how much is a lot of dye?
A lot of dye is about 12 ounces a gallon. A little bit of dye, I'd say a little bit of dye is about 3 ounces. 3 to 4 ounces is a little bit of dye. 12 ounces is what we're considering a lot of dye to overcompensate any green that you may have.
Per gallon, is that what you said?
That's what you said. Did you say per gallon?
Yeah.
Yeah, but how many gallons, depends on how many gallons you're putting in, of course. When I say gallon, I mean in a tank.
Okay, so,
Yeah.
hey,
I'm using it in a tank. So I personally, we talked about this with some of the guys last night. I don't embalm with 3 gallons of water. Again, I think water is a dilution. And so, so I want a high level of index, percent solution, right? I want a high level percent solution. So I achieve that by less water. Use the same amount of fluid that you want to use, but put in less water. And so I don't fill my tank up with 3 gallons of water. I may fill my tank up with 1 gallon of water or 1.5 gallons of water. And it's just the same percent solution that I could get if I added more bottles of water to a tank full, more bottles of fluid to a
When
tank
you're
full.
talking about at 1 per gallon and 1 per 3 gallons.
Yeah.
That's a huge difference.
Big difference,
Like on
absolutely.
a gallon and a half, are you talking 12 ounces of a lot of dye?
12 ounces, for me, on 1.5 gallons, on one case like this, I would probably use about 6 to 7 ounces. So on a full gallon, a full tank, 12 ounces of dye is a lot of dye. You think about those bottles, a full bottle of dye is only 16 ounces. So 12 ounces of dye is almost a full bottle of dye. And that's what, like Jack Adams said on some of that. Sometimes, you could use a full bottle of dye if this case was strong enough and you thought you needed to. Okay, anybody else? Any other questions? No? All right, thank you guys for having me. I got somebody right behind me, right? In the